This is Bob Lightfoot coming to you from the offices of Reinhart, Berner, Van Duren in Madison, Wisconsin. Coronavirus. How many times have you said that word today? Obviously, that's one of the big issues we're facing here in our country right now. This morning, I did attend by computer webinar the DHS update from this morning from DHS Wisconsin. I've also reviewed the CMS recent guidance on visitation for nursing homes and assisted living facilities, and I've also thought of some legal issues and have been getting calls about these issues from clients and non-clients alike on how to handle certain issues, so I want to talk about that as well. But first, I just want to go over some of the items. If you were not able to see the webinar this morning put on by Wisconsin DHS and the state epidemiologist, I'd like to go over a few points of those in brief summary fashion for you so that you have an idea of what's going on at DHS right now with regard to coronavirus and a whole host of issues. I am going to focus then on some questions which came up from the audience that deal with long-term care facilities and assisted living facilities specifically. So first, wanted you to know that it was learned today that approval from the Department of Public Health is not needed for testing. In addition, no numbers are required on that PUI form that has to be sent in. The cases in Wisconsin to date of coronavirus have been travel related and not necessarily international travel. Getting back to tests should be collected using no less than droplet precaution. So what that means is collect this with a flu or a specific coronavirus test kit, and droplet precaution means masks, gowns, gloves, and eye protection. When collecting the sample, there should be a limited number of healthcare providers present. There should be no visitors present. The door should be closed, and immediately following the collection of the testing, the room should be cleaned and disinfected. With regard to specific items related to nursing homes and assisted living facilities in the state of Wisconsin, there was a question about supplies, how to get supplies. As many of you probably have experienced, supplies are in short or no supply. There wasn't a whole lot of advice offered other than perhaps sharing between facilities. If you're tied to a health system, perhaps getting in touch with the distributor that the health system uses in order to obtain supplies. There is no state supply overage of supplies, so that's not an option. However, DHS is working with the federal government on trying to obtain additional supplies for providers. In terms of staff, there was a question about staff. So any staff symptoms, staff should not be at work. In terms of testing for the coronavirus, the capacity for testing is actually increasing right now. There's only 2 labs that are doing the testing, but that will be increasing. And it was clear that the provider is the one that should be ordering the test with coronavirus. There was a question about restriction on visitation, and I'm going to go into that later because I have reviewed the CMS guidance on visitation. It's rather strict. My understanding is today, March 13th on Friday, DHS will be putting out additional guidance for visitors in long-term care and assisted living specifically. But as of this morning and as of right now, what the DHS is saying about visitation is that it is highly restricted. It is the highest of priority is nursing home, and I would venture to say assisted living should be brought into that discussion as well. But right now, DHS did say this morning that nursing home restrictions are the highest because that has had the highest mortality rate for folks who have contracted coronavirus. So the guidelines are very strict. I'll go through the rest of that later when I talk about the CMS guidance. Going back to testing, another question had come up about what mask to use. DHS has recommended the N95 mask. That is preferred, and again, droplet precautions to be in effect while obtaining the test. Another question came up about what is close contact. That has been a little bit vague. Close contact this morning at the webinar was defined as within 6 feet of a coronavirus case for a prolonged period of time, and any direct contact with secretions of a coronavirus constitutes close contact. So for healthcare workers who have traveled, you must exclude them from work if they have been exposed. You have to look at the level of risk of their travel. Right now it appears as within the United States, the highest risk areas appear to be California, New York, and Washington states. In terms of countries, we do know that Iran and obviously China are high on the list, but DHS does have a list of the risk levels involved with the travel to the different countries. A question came up of where to get test kits from. First of all, you can use the same test kit for coronavirus that you would use for any viral or influenza test. The test will be done at one of the 2 reference labs. As I said earlier, there will be additional labs that will be coming online. Another question came up, can nursing homes do testing? The answer is yes. Nursing homes can collect at the bedside, but again, use the droplet precautions with the appropriate PPE being used. Another question did come up as to the number of test kits. Those test kits are not at this time unlimited. Right now in Wisconsin, there are more than 200 kits available. They are working, DHS is working so that we can get to so that there will be 100 to 150 test kits per day, and 100 to 150 tests that labs per day can do with those test kits. Right now, DHS said there are no known coronavirus cases in any Wisconsin nursing home or assisted living or like facilities. That's good news. For hospice, there was a question about access to nursing home residents by hospice workers. DHS said access should be okay if it's medically necessary. Again, you will want to do the screening, the appropriate screening as you would for any visitor into a Wisconsin nursing home to ensure that there is not symptoms present or recent exposure within 14 days. There was also a recommendation by DHS that nursing homes should cease all community outings and social gatherings as a preventative measure to prevent the spread of coronavirus. There was a question about whether nursing students should be going into facilities as part of their educational programs. And DHS this morning said it was reasonable to not allow students into the nursing homes pursuant to their educational programs at this time. In terms of, again, visitation, I'll go over that, but many questions did come up this morning on visitations. The main point was to develop a policy and do the testing, restrict residents going out of the facility with family members to prevent community spread and also to prevent any residents from becoming infected and bringing that back to the facility. And then finally, with regard to the DHS seminar this morning, there was a question about sending patients with symptoms to the hospital for testing, and the clear message there was do not do this. Do not send symptomatic patients to the hospital to be tested. That testing can be done in the facility. So that's a summary from this morning. Now I'd like to go over the CMS memo. The caveat to this is that this can change hourly. In fact, as I'd said earlier, I am expecting a memo this afternoon from DHS, and I believe it will be even further restrictive of these measures that I'm about to talk about. But right now, on the CMS website, I'll direct you to that at the end of the presentation here, but there is a place where you can go and review what I'm going through right now, which is the recommendations on visitor restrictions as put out by CMS. So right now, it's okay to restrict visitors for reasonable clinical and safety concerns and to prevent community-associated infections and community disease transmission to residents. So that's the foundation right there. You do have regulatory authority to restrict visitors. Actively restricting visitors should encompass several ideas. The first is to make sure that visitors do not have signs and symptoms of a respiratory illness. That would be a cough. That would also be such things as a sore throat, shortness of breath, and fever. Those four things in particular should be screened before any visitor is allowed in the facility. In addition, a screening by a visitor should include asking them whether in the past 14 days they've had contact with anyone who's had respiratory illness symptoms or contact with anyone with coronavirus. In addition, there should be a screening question regarding recent international travel within the last 14 days to any affected countries that are on both a federal or our state DHS list, or communities or states, as I referenced earlier, such as California, Washington, or New York State. Finally, you may allow entry to someone if they do not have any of these symptoms or travel conditions or restrictions once you've screened them. But they are recommending that visitor use PPE. So make sure you do have PPE available. Make sure you have hand sanitizer, or insist upon that visitor washing their hands before they come in. So along these lines, CMS recommends increased signage at the front of your building, at all entrances to the building, so that visitors know exactly what they're in store for and what kind of screening they're going to have to undergo before being admitted into the facility. Yes, this is relatively extreme, but it's what's being recommended by CMS at this point. So things you may want to advise in a sign is that visitors may be subject to having their temperature checked, to having to wash their hands, to wearing PPE. You may want to instruct them on hand hygiene, to not touch surfaces, how to use the PPE. Once inside, if you do admit visitors, you want to instruct them to have them limit their movement inside a nursing home or your assisted living facility. They should either go to a designated area or they should be remaining in their loved one's room and not be walking about the facility to potentially transmit anything they come in with. In addition, you may want to ask the visitors to limit the amount of time that they spend in the facility. That can be difficult, but it appears to be necessary at this point in time. You want to also offer to your family members alternative means of communication, such as phone, video. You may put together a listserv for family members so that you can keep them updated on the goings-on in your nursing home or assisted living community. You may want to assign staff for certain calls to be made, or you may want to have a phone line that people call into and get updates on exactly what goes on. The last thing is, if you do admit someone, create a log and have them sign in so that if something unfortunate does happen later, that you can track that if tracking would become necessary. So these are very strict measures. I expect them to be even probably more restrictive once the guidance from Wisconsin DHS comes out. But right now, the mortality rate for anyone 84 years and above is greater than 15% right now. So these measures seem to be very important. Let's talk then finally a little bit about some of the legal issues that have arisen with regard to coronavirus. With regard to the right to visitation, you have to follow this guidance. You have to. CMS is saying you have to, and you're going to want to do that. There's going to be an emphasis, if you're being surveyed by state regulators, and I believe this is true for assisted living, it will be true for assisted living as well. Obviously, the emphasis is going to be on infection control right now. So you should know that. What should you be doing? You should be reviewing your policies and procedures, your protocols, your infection control, do additional training, show and demonstrate correct hand hygiene, the full 20 seconds with soap and water, proper technique, isolation procedures. And then finally, with employee issues, some of those are already popping up. We've had some questions about employees not wanting to come to work with either no residents with issues or some residents that have flu-like symptoms, but it's not coronavirus. Remember, those are issues that you can always contact us about. So I didn't want to go too long on this, but I did want to give you an update. If you have any questions, feel free to contact me, Bob Lightfoot, at Reinhart Burner Van Duren at 608-229-2257. I'm going to give you here the websites. So first is the DHS website for coronavirus. The second website I've listed is the CMS website that contains the visitor restrictions on what they want to see. The next is our firm's website. And then finally, I just want to show you, I did create a poster that you might want to be using out at the front of your facility just as an attention to visitors. If you email me, I'd be happy to email that to you to use either as is or as your template document. So you can email me at rlightfoot, RLIGHTFOOT at reinhartlaw.com. So thank you very much, and I hope this is helpful to you.